A grandmother of 3 is enjoying a new life without diabetes, high blood pressure, or high cholesterol.
This is a before picture of Ann Kemmer. This is before she had gastric bypass surgery, while she was on medication for all 3 of those problems.
And we're really happy to have her with us today, a healthier and happier person. And we have Dr. Jon Schram, her bariatric surgeon from Spectrum Health, here too. So welcome both of you.
Thanks for having us.
And then, wow, big reveal here, Ann. You look like a different person from the picture we just saw. Can you just kind of take us back, you know, maybe 6 to 8 months and this diagnosis that you received?
Well, in November, I went to see my physician for my regular yearly checkup, and I had a new diagnosis of diabetes. And diabetes affects my family. I know how, you know, the side effects of it. And I, this year, have added 3 grandchildren to my family. And just the thought of me being sickly or something happening and not being able to play with them. I see my parents who are healthy and active, great grandparents, and I want to be like that when I get their age, and I don't want to be, you know, ill and on medication.
Yeah. And you don't want to miss out either.
I don't.
Which is important, to be able to be active and energetic and be able to play and chase them around and all that stuff. So Dr. Schram, she came to see you, and the process really began just at the beginning of this year.
Yeah. So in January she came, and Ann, like many patients, you know, suffers from sleep apnea, and she had cholesterol issues, she had diabetes, newly diagnosed. She was interested in taking care of those problems, and so we talked to her about different options for weight loss surgery. And she underwent surgery in June of this year, and within 10 weeks her sleep apnea has gone, her diabetes is gone, and her cholesterol is under control.
Wow.
So she's had a, you know, really transformative process, which really just kind of speaks about how the operations, it's not so much about weight loss, but how they really affect your overall health.
Yeah, we're seeing some video right here, and this is in the operating room, I take it?
Yeah, looks like it, yep.
And so the surgery itself takes about how long? It's pretty quick.
So the operations can take an hour or less, depending on which operation you do.
Surrounding it, I mean, we talk about her coming to see you in January, the surgery happened in June.
Yeah.
Is that pretty typical? Yeah,
so many of the insurance companies require patients to undergo a period of medical weight loss before they can undergo the operation. So we provide that service for them. It usually requires monthly visits for maybe up to 6 months. And once we get through that process, then they usually get insurance approval, and then we can go onto the operating room. And the operations are done, you know, with the laparoscope, and they usually take less than an hour. Most people are in the hospital overnight, go home the next day, and are back to pretty normal activities within a week or 2 of the surgery.
Yeah, so you look incredible at 10 weeks really since the surgery. You look like you are active and energetic. How much weight have you lost, and how was that recovery from the surgery?
So far I've lost about 40 pounds. The recovery, it was quick. I don't even, you know, it wasn't even something that I'll remember forever. It was by 2 weeks after my surgery, I was walking a 3-mile block with my husband. Wow. I can run. I tried running. I won't be a runner, but I tried it. And I was able to do it, which is different.
Yeah.
Yeah, I have so much energy.
It's a process. I know that, you know, we talked about up front before the surgery, there's so much that happens after as well. And I know that this is really a team of people. It's not just one doctor. Well, you did excellent work. A team of people that work with a patient to make it successful.
Yeah, you can't do this without a team, and we have a spectacular team, from my physician assistants to the nutritionists, dietitians, behaviorists. We have a new psychologist who specializes just in weight disorders and eating disorders, and all the medical assistants. So you can't do it without a great team, and that's, you know, what really makes it a lot better for us and easier for us to do the process.
And how important was that for you, Ann? Because I'm guessing that probably like a number of people, you were overweight for a number of years.
For a number of years. And Dr. Schram's team, they're indispensable, because the 6 months up to that point, you learn to eat differently. They prepare you, you get a binder, they give you like sample meals, what you should be eating for, you know, this week. And then as you know, progress to eating different foods, they give you samples, they give you shopping lists, and you're so informed and educated by the time you have the surgery. It's so simple.
You're ready.
You're ready.
And how are you coping with your real life? I mean, 10 weeks has not been that long. It's still kind of fresh.
It is.
And it's something that impacts the whole family. Your husband, for instance.
Yes.
He's kind of living in a new model too.
Yes, he is, because I no longer get hungry, so I don't remember to cook. You know.
And you're probably buying different food too.
Yeah, it's odd. I never knew what time it was because, you know, you get hungry at 6 and I'd be doing something and he'd be looking for dinner and I'm, oh yeah, it's dinner time. I forgot.
Yeah.
One of the benefits of the operation is that we reduce the hormones produced in the stomach that actually affect appetite. So patients come to us all the time afterwards and say, I just don't feel as hungry as I used to before the operations, which is one of the reasons why these operations are so successful.
Yeah, and then you look at those improvements, the high blood pressure, the cholesterol, the diabetes, gone. These are incredible. These are just massive diseases, and
gone.
They're cured.
Yeah, and there is no cure. We know a medical cure, or you know, something
just
you can
management.
take. Yes, for diabetes right now, and so we're really excited for you in your new life. And I know that you have a team that's ready to talk to people who also might be wanting to make a change like Anne, and so what we suggest is just calling Spectrum Health. We've got the information here. We'll also put it at the 8 West section of woodtv.com, so it's easy to find. You can register online. We know that you have a lot of sessions that people can attend, and that's really helpful too.
And another important part of the team is the person to help you through your insurance, because I know you have experts on staff to help people manage that part of the equation
that's often
as well.
sometimes people get really afraid of the whole you know, morass that they're going to have to go through, but we've got people who will help them get through that.
Yeah, so don't be
every
afraid.
insurance company is different, but they know all the ins and outs. So.
Great. Thanks for joining us.
Thanks for having us.
We'll be right back.
This is 8 West.